Elena Moskaleva. Okay. Hello, Mr. Smith. I'm Elena, I'm your nurse for today for health assessment. Can you tell me your last name and first name?
John Smith,
Can you tell me birth date?
April 5th, 2008,
Do you know where you are right now?
Humber River Hospital,
Do you know what day is it today?
January 8th, 2025.
Mr. Smith was admitted to hospital today with vital signs, temperature 39.7 Celsius. He has a high fever. His heart rate is 115 beats per minute. He has tachycardia due to the high fever and pain. His respiration rate is 22 breaths per minute. He has mild tachypnea due to the pain and fever. His blood pressure is 115 over 70. It's a normal range. Do you have a headache?
Yes, and my neck is really stiff.
Do you have seizures?
No,
Tremors?
no,
Weakness?
no,
Do you have difficulty swallowing?
no.
Do you have dizziness or vertigo?
Yes, I feel dizzy.
Do you have a numbness in your fingers?
No,
Did you have a head injury?
no,
Do you have shortness of breath?
no.
Do you have cough?
Yes, I have a cough. It's
Is
not
it-
too bad.
Is it productive? Anything is coming out?
No,
Okay. Is it painful for you to breathe?
no, but my chest hurts a little bit.
Do you take any medications?
Yes, insulin. I have type 1 diabetes.
Do you have allergies?
Yes, penicillin.
About your headache, when it started,
1 day ago, it is worse today.
what makes it worse?
Movement and lights.
What makes it better?
Falling asleep.
What's the quality of the pain?
Throbbing.
What's the region?
All over my head.
Is it radiating?
It does not spread.
What is severity from 0 to 10? 0 is no pain, 10 is the worst pain you ever had.
The worst, 8 out of 10.
What time of the day you have a headache?
All the time.
What treatment you tried?
I tried to take Tylenol and Advil, but it did not work.
Do you know why you have a headache?
I don't know.
I will recommend Mr. Smith to have acetaminophen 650 milligrams by mouth PRN. So now we'll do a pearly assessment. I will measure the pupil's size. All right, please look at the pen. Thank you. Now it's going to be a bright light in your eyes. Don't blink. Thank you. Thank you. Pupils are equal, round, the size number 4, reacting to light and accommodations, eyes open spontaneously, patients obeys commands and he has a clear verbal response. Can you please squeeze my fingers? Please lay down, push your legs up, down. You can take a seat. I will do hand hygiene. Hands grip is strong, equal bilaterally, legs strong, equal bilaterally. We'll do inspection. His lips pink, no cyanosis. His skin color is matching his ethnicity. Patient is oriented to person, place, and time. Patient breathing is non-labored. He has mild tachypnea. He's not using accessory muscles. He's flushed. He's ill-looking. He's uncomfortable but alert. He has no tremors and no rigidity. We'll do auscultation to anterior side. I will listen for full inhalation and exhalation at each point. Please make a deep breath. 1, 2, 1, 2, 2, 3, 3, 4, 4, 5, 5. Thank you. The breathing is clear. It's a good air entrance from the apex of the lung to the base of the lung. I didn't hear any adventition sounds as crackers or whistles. Patient's bronchial sounds are loud, high pitch. Inspiration is lower than expiration. His bronchiovesicular sound is medium pitch. Inhalation is equal to exhalation. His vesicular sound is soft, low pitch, and inspiration is higher than expiration. SBAR. Patient Mr. Smith, male 17-year-old patient, was admitted to ER today with a strong headache, dizziness and fever. He has type 1 diabetes. He has no history of seizures, no head injury, no numbness in his fingers. Pain for headache is 8 out of 10. He tried Tylenol, not helpful. He takes insulin and he has an allergy to penicillin. During assessment, I found that he has a strong headache, neck stiffness, and he has photophobia. He has mild tachypnea. He has a mild cough, no accessory muscle used during the breathing. His GCS score is 15 out of this 15. Perley is normal. His vital signs, he has a fever, 39.7 Celsius. He has tachycardia, it's 115 beats per minute. He has tachypnea, it's 22 breaths per minute. The rest of the vital signs are normal. I expect MD to order the urgent assessment for meningitis and prescribe antipyretics as acetaminophen and ibuprofen for fever relief and for pain. I think patient might have meningitis because he has a strong headache, he has a neck stiffness, he has photophobia, and he has a high fever. My nursing intervention is to provide a cold compress to his forehead to relieve the pain and discomfort, to dim the light in the room because it's hurting his eyes and worsening a headache. The rest is recommended. Also, I will monitor his vital signs and his fluid balance. I will prep him for IV fluids, 0.9 normal saline, to prevent dehydration due to the high fever and just to support his circulation. For MD, I expect the MD to put the patient on a droplet precaution to prevent spreading of the meningitis. To order test is a blood culture and a lumbar puncture to confirm meningitis, X-ray to rule out respiratory infection, full blood count to check for any infection, and to prescribe IV broad spectrum antibiotics as vancomycin, which is safe for patients with allergy to penicillin. Thank you, Mr. Smith.